us. I'm Kim Perry, Executive Director of DC Action, and I'm also one of the leaders of the Under 3 DC Coalition. Thank you so much for registering for this webinar and joining us today. The webinar is entitled DC's Early Childhood Educator Pay Equity Fund Shows Transformational Impact. Under 3 DC is a growing community of early childhood educators, child care program directors, health professionals, community-based organizations, nonprofit advocacy groups, business leaders, and parents, working together as a coalition to ensure that the Birth to 3 for All DC law receives its full funding and is fully implemented. As many of you know, the Birth to 3 law is making childcare more affordable here in the district, providing critical family well-being supports such as home visiting, child development, and behavioral health services, and ensuring an equitably compensated workforce in our early education and childcare system. This 90-minute webinar will be recorded, but also our goal is to inform you about recent modifications to the Early Childhood Educator Pay Equity Fund based on available public funding, as well as share the latest research findings on the effectiveness, financial costs, and benefits of the program. The Pay Equity Fund is an innovative approach to address pay disparities between our early childhood educators and our K-12 educators. It was established in 2021 due to the strategic advocacy of the Under 3 DC Coalition, who spearheaded a successful revenue campaign to convince our local legislators to raise taxes on our highest earners in order to provide a dedicated funding stream to equitably compensate our early childhood educators. But just when the program was in its infancy, about 2 years into implementation, our mayor eliminated the entire program's funding in her budget proposal, and the Under 3 DC Coalition sprung into action, mounting one of the most powerful campaigns the city's ever seen to win it back. The DC Council heard our calls and the calls of educators and parents and unanimously moved to restore the program, but could only secure about 80% of its original funding. Nevertheless, the program is still in place, but with some modifications. So with that background, let's get this webinar conversation started. I'm pleased to introduce our moderator, Bibi Otero, who also serves as a senior advisor to the Under 3 DC Coalition. If you don't know Bibi, you should know that Bibi's the president of the Otero Strategy Group, a consulting practice in the areas of education, health, and human services and community development. Bibi has experience in formulating and executing policy related to early childhood education and community development. Prior to founding the Otero Strategy Group, Bibi served as deputy mayor for Health and Human Services for the District of Columbia. She currently also, because she has so much spare time, serves as special assistant to Montgomery County, Maryland's county executive. Bibi is also the founder and former president and CEO of Centronia and DC Bilingual Public Charter School, both community-based nonprofit organizations providing a range of bilingual educational and family support services to children, youth, and their families in the District of Columbia in the area. Bibi, I will now turn this conversation over to you. Thank you so much for saying yes.
Welcome, everybody. And Kim, thank you very much for those kind words. This is labor of love that we all do. So, and happy to see so many people representing across the country who are interested in this work. As we get started, we have a group of really excellent panelists that will share details about specific aspects of the Pay Equity Fund and how it was implemented. But let me put this in context a little bit in terms of how we got to where we are in the District of Columbia. DC has always had a very strong early childhood programming back in the early 70s when we were one of the first sites for Head Start, as well as pre-K in the public schools. Fast forward to the level of advocacy and work that was done during those periods of time. Fast forward to 2008, when the council passed the Pre-K Enhancement Act. And the Pre-K Enhancement Act was basically the District of Columbia Universal Pre-K. At that time, Vincent Gray moved that legislation, and 3 and 4-year-olds were received from that time on free uh, pre-K classrooms in traditional schools, charter schools, and community-based settings. So that was in 2008. The original legislation was to be a 0 to 5. It really ended up being only pre-K. That left our babies out of the equation. And so by 2018, we were able to, again, Vince Gray, as the chair of the Health Committee in the council, was then able to really champion the birth to three for all law. And that law basically sets up a systems approach to meeting the needs, as Kim said, of families and children, and in particular for that age group of infants and toddlers. And there are several provisions, but today we are focusing on pay equity. And it was very much a key piece of that legislation that basically one of the provisions that stated that fair compensation for early childhood educators was a key part of really developing this whole system. And I always talk about the fact that one of the most significant pieces when you are working on a piece of legislation is making sure that you use the language that will carry through what you want that policy to do. And what we talked about in that legislation was basically parity with public education. That set the tone for moving forward with what you'll hear about today in terms of pay equity. We did not talk about living wage or minimum wage or fair wage, but we were very clear about that legislation being parity. And you will see in the conversation today that that is really what led the way to where we are today. The second, I think, really critical piece that Kim already alluded to was the fact that in order to be able to work this through the system once a piece of legislation is passed, was to have a strong coalition, and a coalition that was cross-sector, and you'll hear more about the coalition later today. And the third piece was really beginning to develop the data and understanding the impact, and you'll hear that in a presentation today. There's a fourth piece of this that I think is really critical to talk about, and that is the level of philanthropic support that backed this work. Not only is it, as you'll hear, and as Kim already stated, did we raise public revenue for this, but also philanthropic support to back up the work, especially the work of a coalition across the board. So with that said, I will introduce our panelists as I set the context here. And so joining us today are Abigail. Let me start with Abby Smith. We know her as Abby Smith. And in fact, Abby and I were both deputy mayors at the same time in the District of Columbia. So welcome, Abby. Abby is with Blue Sky Education. She has spent her entire career focused on improving quality, equity, and access in public education. From 2012 to 2014, she served as deputy mayor of education in the District of Columbia. She currently works as an independent consultant supporting a range of education-focused organizations in advancing their missions through strategic planning, organizational development, program design, and executive coaching. So welcome, Abby. We also have Owen Shoshay from Mathematica. Dr. Owen is a public policy researcher with Mathematica who specializes in quantitative approaches to evaluating the effectiveness of public programs and policies that serve young children, their families, and their educators. He received his PhD in human development and public policy from Georgetown University. and he is director of the Early Childhood Educator Pay Equity Fund Impact and Cost Effectiveness Study. And so welcome, Owen. And Rokaya Ambar Shaheen, she is with DC Action, and Rokaya's work combines her experience with direct service, coalition building, and policy research and analysis. In her role, she conducts research, advocacy, and coalition building to promote policies that make DC a place where all children have equitable opportunities to thrive. So welcome and thank you so much for taking time to share the experiences from these three very different perspectives. So let's start with Abby. There was already a piece of legislation, the Birth to Three Act. Why was a task force necessary? And can you tell us more about the purpose of the task force, its membership, and what are some of the most impactful recommendations that the task force made?
Thanks, Bibi. It is great to be here. This has been an exciting project and obviously an ongoing one. So I'm eager to share some of what we've learned with folks. I just did a quick look through the webinar chat and I counted 9 states plus DC represented as of when I looked. And I know that every one of those places looks a little bit different. Your governance is a little bit different. The context is a little bit different. But I do think, oh, I just saw Mississippi added. All right, make that 10 plus DC. I do think that what we've learned in DC is there are lots of pieces that we can pull out that are applicable to wherever it is that you're from. I'm going to talk a little bit about the Early Educator Equitable Compensation Task Force, as Bibi mentioned. So there was legislation that was through the incredible force of the coalition of advocates that worked towards it and the work of the DC Council that was passed and signed by the mayor. So here we had legislation and we had a pot of money that the council had allocated and said, all right, we are going to create a new taxation element to be able to raise dollars for increasing the wages of these incredibly important workers who are day in and day out caring for and educating our youngest children. So that was a pretty great place to be. But I think that we realized at that point that there were lots of questions about how it was that we were going to go about implementing this program. So here's this pot of money, what we were going to do with it. So one thing that we have done over the last several years is work through this task force model. So in 2021, again, after the legislation was passed and after dollars had been allocated, the DC Council created and appointed this task force, which was made up of 15 folks with a whole range of experience, including childcare educators. So we had frontline folks and childcare owners. Owners and directors, so from both for-profit and nonprofit facilities, advocates, policy experts, economists. We ensured that there was a really broad set of skills, experience, and knowledge that were going to be around this table. And we were given just a few months to come up with recommendations about how it was that the state agency should implement this legislation and actually roll out these dollars. So the task force was charged with a few key things in presenting recommendations to the mayor and the council. One was, what was this impact? What would be the impact of introducing this program on early childhood development providers? So we wanted to understand what some of the implications would be in terms of how it might affect this market, because part of the play here is we want to stabilize what is a notoriously unstable market in childcare. We want to do it in a way that's increasing quality. We want to do it in a way that is also ensuring the pay parity that Bibi talked about, while not passing along all of those costs that come from that to families. So there was all of these different elements that we wanted to consider. And from that, to propose a specific compensation scale for early childhood educators that would account for role of the employee, so a teacher or assistant teacher, and the credentials they had earned and their experience level. I'll talk a little bit more about that third piece later. And then to recommend how it was that we would actually implement this scale. So that task force worked for, again, just a few months to come up with those recommendations, which the council adopted in full. And what that meant was that the voices of people who this was going to directly impact in various ways were at the table as we developed what this program would actually look like. And that meant some hard conversations because we definitely come from different places. There were some limitations that existed in terms of the context, some pressures in terms of time. And I think that those of you who have been sort of following this along from the beginning may know a little bit about some of the specifics about what the program looked like. And we're going to talk a little bit more about that later. But this sort of how we got to it, I think, was a really key piece. Let's move to the next slide. So a little while into this, the implementation had started, and we went through 2 phases of implementation that I think Bibi's going to talk about a little bit, and realized that there were just some questions around. The program had now been around a little bit. There was significant uptake in terms of participation on the part of providers. So we were seeing lots of success in terms of the program being rolled out, but there were some questions around, how might we tweak things moving forward. And so the DC Council asked OSSI if it would reconvene this task force, which we did with mostly the same folks the first time around, which was very helpful because there was a lot of institutional knowledge then at the table. But we added several people, including additional frontline workers, both providers and educators, so that we would have more of those voices at the table. And just as we began our work, as Kim mentioned, the mayor decided for a whole host of reasons to cut the program. And there ended up being this big advocacy fight. So the task force this time around thought we had just a little bit of tweaking to do. And it turned out that we had a much bigger challenge that faced us, because while we did end up getting back to a level of $70 million a year, which sounds like a lot of money, it wasn't enough money to be able to maintain the program exactly as it was. And so we knew we would have to make some big changes. So we spent some time as a task force looking at what we'd learned thus far in terms of how the program was operating, and then considering these big questions related to long-term sustainability. So if we were to be funded at this same level for the next several years, which is now what is in the budget, and we'll each year the budget gets another look, but what would it look like to ensure that the program remains solvent and continues to be aligned with the values that we set into place? So we have done much of that work, and at the end of September, submitted another set of recommendations, which again the council has taken on and accepted. And I'm going to talk a little bit about what some of that looked like. But I want to share the guiding principles, and we can go to the next slide here, that the task force has operated with, which I think are just really important in terms of, again, the process, the sort of how we went about this. So the first one is around bringing the expertise of the room to the table and the discussion. So that meant that regardless of what the experience was that you were bringing something valuable, and we needed to really hear that and consider different approaches. And there was disagreement in the group. So there were times when, depending upon people's perspective, experience, focus, they were on different sides in terms of how we might move forward. And so we really had to lean into that and listen to each other, and make decisions that took into account these different perspectives. We really tried to ground our analysis in data and what we've learned, and Owen and other researchers are helping us to continue to do that. And for us, we wanted to think about what this looked like within our diverse delivery model. So, as is the case in many places, our childcare market has a huge range of the types of providers. So whether it's child development homes or centers, small centers, big centers, multi-site places, places that are nonprofit and for-profit. They're places that have sponsorship from the federal government for for their building location, for example. So a huge range. And we knew we wanted to address what this would look like across that whole diverse model. And then very importantly, to center those furthest from our opportunity. This program in so many ways is an equity play. And we know that certain programs have more access to resources than others, and we wanted to center that in terms of what the specific policy recommendations were. And we asked everybody to just share the implementation hat. So it's easy to put out there, I think we should do this, and have some grand plan. And then if someone steps back and says, well, how are we actually going to operationalize that? We don't have the data system to do it, or we don't have the human resources to do it, or that's going to be way too complicated. We wanted to really consider how this would look in implementation and consider unintended consequences. So these were the principles that guided us through all of our work. So there's a lot on this slide, but I wanted to just give a little bit of a quick sense of the range of things that we were thinking about in terms of the questions we needed to ask. So scope of the program, what roles should it include, and what should we think about beyond wages? So there's wages is obviously a very important part of the picture, but we also ended up including a healthcare component, which is significant, costly, although worth every penny, I would say. But what that scope looks like is an ongoing question. What is the funding formula like? So we've got this pot of money. How do we distribute it in a way that is equitable and efficient? So that was probably the key piece this time around. And then what does that salary scale look like? So to give you all a little sense of just, general range, our salary scale now in terms of what the minimum salaries are for folks with at least a CDA, that minimum salary is $51,000. And the minimum salary for lead teachers with a BA is $75,000. So that gives you a little sense of the scale. So for a lot of people, for most of our educators, this is a significant increase in pay. It's not it's not a marginal thing. It is significant, which drives all kinds of other things in terms of quality and credential attainment, and some of the impacts that Owen will talk about. And then finally, sustainability. So what are the cost drivers? What are the projected revenues? And how are we going to make this work in a dynamic environment where in any given year, you might have increased participation, you might have a shift in what degrees people attain and therefore their minimum salaries, and how are we going to adjust with that as we go along. So one more slide where I'm just going to highlight a couple of the things that came out of our recommendations this time around. If you go to the next slide, Kim. So there were a few big picture or categories of modifications that we made this time around, and I'm happy to answer questions if people want to get a little more in the weeds. The first was we ended up moving towards a stronger alignment between educator licensing standards and the pay equity fund implementation. Now that sounds all very nice, but what that meant, practically speaking, is that for many educators in this new round of the pay equity fund that kicks off in January, their minimum salaries are going down, because we are saying if you don't yet have a CDA, that's the minimum licensing standard. You are not going to have anything beyond any guarantee beyond DC's minimum wage, which is better than in lots of parts of the country, but still, not particularly high. So that's going to have a real impact on real people. And while providers certainly are welcome to pay them more, the funding will probably not support it. So that will practically speaking mean that if you don't have your CDA yet, you're getting a significant pay cut. We made a choice to double down on the equity adjustments that were part of our formula. And so what that meant was ratcheting up the extra weight that you have for serving children who are on subsidy. So that was one piece. Adding an additional plug if you serve significant numbers of infants and toddlers versus 3 and 4-year-olds, because that's really our focus need, and it's more expensive to serve infants and toddlers. And then also adding an additional weight to what each facility gets if you're a child development home versus a center, because again, their margins are very narrow. And so we knew that adding a little bit extra to their funding was going to stabilize things. And then also changing some of the eligibility where our programs that are at the highest end of tuition, so at 90th percentile or above of tuition, are not eligible for quite as many dollars as other programs, because the idea is they have access to additional resources. And so if we're choosing and targeting resources, that's where we need to be. And then the third thing that we did was establish some concrete ways for how we would address potential cost pressures. So both in terms of access to the healthcare for childcare and in terms of providers participating in the Pay Equity Fund. We identified some ways that we thought were equity focused in terms of how we would prioritize who has access to some of those resources. So I know that was a lot. I hope that folks will drop things in the chat if you have questions that we can talk about later in our conversation.
Thank you so much, Abby. Great presentation. It puts into focus all of the work that's been done and how important it is. I think the couple of things that Abby raises here is the importance of not only having a piece of legislation, but then really the implementation and operationalizing, and the role of the voices from the field in doing that. I think that is a real lesson in this process, and making sure that isn't left to simply an office within a department somewhere, which is usually what happens with a piece of legislation when you write up all of the implementation and operationalize. And then centering equity. I think that that was a really key piece, and that's where this healthcare piece also comes in, because we know from many studies across the country that as salaries go up, many of our teachers lose their public benefits. And one of the key public benefits, obviously, is healthcare. And so that partnership with our healthcare exchange at the District of Columbia was a very important piece of work in this. So thank you, Abby, for raising all of those. So before we move into Owen's presentation, I'd like to put just a little bit more context in terms of how we proceeded. So the Pay Equity Fund was done in 2 phases. So phase 1, and that is where Owen will talk about the results of the study and their findings. It included direct supplemental payments to home and center-based educators. It was a annual payment of $10,000 or $14,000. And this was done through multiple payments and through a third-party intermediary. And the purpose of that was to give the state office, the state education office, who is in charge of implementing, time to be able to build its infrastructure and to be able to implement over time and make sure that we work through all the kinks. Although, as you heard, that's an ongoing piece. And the second phase, which then was in 2023 and 2024, and hopefully beyond long term as a mechanism, is and utilizing the salary scale as Abby shared, that was done then through direct payments to the facilities, as Abby talked about a bit more, and implementing the salary scale, all of the various credentials and experiences and so on, focusing on infrastructure and infrastructure maintenance, including ongoing technical assistance to providers. These were all critical pieces then in phase 2, and obviously the data collection. So that's just to give a bit of context, because what you'll hear about was the first phase, which were direct payments. So Owen, you looked at the data for the first stage. Can you tell us a bit about what you found when you began looking into the costs and the benefits of the Pay Equity Fund in the District of Columbia?
Yes, I'd be glad to. It looks like maybe there's a little formatting error here as it's rendering, but that's okay. Yeah, so my name's Owen Cherchet. I'm a researcher at Mathematica, and I'm directing the Early Childhood Educator Pay Equity Fund Impact and Cost Effectiveness, or PEF, Impact Study. Kim, you can go ahead and advance the slide. Thank you. Okay, so I'd like to begin just by expressing my gratitude for the funding and support provided by the Bezos Family Foundation and DC Action and our partners at those organizations. I'm also very grateful for comments and information provided by staff at the Office of the State Superintendent of Education, the DC Fiscal Policy Institute, and the DC Health Benefits Exchange Authority, and the Under 3 DC Policy Working Group members. And just a sort of a standard disclaimer that the content of this work represents sort of independent views of the authors and not necessarily the views or policies of anyone else that I've just listed. Okay, so next slide, please. Great. So we are conducting the Pay Equity Fund Impact Study to inform discussions about the effectiveness of this important program. Effectiveness can be understood both in terms of impact, right? So what are the benefits of the program? And in terms of public investment. So does the economic value of these benefits justify what it costs to generate them? I'll begin with an overview of the framework that we're using to think about the benefits of the program, and then share our recent findings on the impacts of the program on the early childhood labor market in DC in particular, before reviewing some just published findings on the program's economic returns. As Bibi just described, and thank you for doing that, our research is focused thus far, right, on this first iteration of the fund, where payments were delivered directly to educators. So that's important context here. Research maybe takes a little bit of time to catch up to implementation. As part of our study, we are continuing, right, to evaluate the program as it's being implemented now, and so there'll be much more to share in the future. Okay, so next slide, please. All right, so we consider several benefits of the Pay Equity Fund in our research, and this spans both types of ways of evaluating effectiveness, right, in terms of impacts and outcomes, and in terms of dollars. Now these benefits are organized into those that accrue to three groups in our model here. So those to educators, those to their facilities, and then the families that are served. For educators, greater economic, personal and professional well-being may reduce work absences and increase the amount of time that they stay in their role, which leads to more work experience and job skills. Higher wages also mean that fewer educators need to rely on public assistance programs, and subsidized health insurance through healthcare for childcare may also improve educators' health, lower their healthcare expenditures, and reduce medical debt. For early childhood facilities, when staff are retained, right, administrators can focus less on recruiting and onboarding and training new staff. Similarly, fewer absences also reduces the need for administrators to find staff coverage. We finally also consider benefits to families. Higher pay and benefits not only help retain existing workers, right, but also help recruit new ones, but both of which are important in a sector with well-documented staffing shortages. A healthier labor supply means that facilities can offer more slots, which increases access to care. And then finally, by increasing educators' work experience and job skills, promoting stable relationships, right, between educators and families, and improving the ways that facilities operate, the Pay Equity Fund can improve the quality of care that families receive. Next slide, please. Okay, so first I'll just share our recent findings on the impacts of the program, specifically on benefits that accrue to families via improvements to DC's early childhood labor market. So this includes the impacts of the fund on the supply of childcare in the district. Next slide, please. Thank you. So I won't spend too much time on the methods, but we'll just provide a little context here. So just as a clinical trial, right, for a new medication compares outcomes between patients who do and don't receive a treatment, right? Estimating impacts of a public policy or program also needs a control group. Here, right, that would be a group that represents what would have happened in DC without this program. Of course, this isn't something we'll ever truly know, so we need to approximate it using some statistical methods. In this case, we use what's called a synthetic control method, which produces a synthetic version of DC, which is in fact a weighted combination of several other areas across the country. And we used some federal labor market data collected by the Bureau of Labor Statistics to do this. Next slide, please. I won't spend much time here, but there were 9 counties that formed our synthetic DC. And again, right, these counties were selected because they, when combined in certain combinations, right, they approximate what DC looked like, both in terms of its early childhood sector and across several other sectors that we balanced on over the several years leading up to the launch of the program. Next slide. All right, so here we can see this in terms of the number of early childhood educators, right? So the solid line here shows the number of educators in DC over time, and the dashed line for the synthetic DC. Before the launch of the Pay Equity Fund in 2022, indicated here by the vertical red line, DC and its control, right, have the same number of educators, and this, notably includes both before and after the start of the pandemic, which led to a sharp decline of in the workforce across the country. So to determine the benefits of the program, we can then compare DC with this estimate of DC without the program. And so we find that by the end of the 2023 fiscal year, the Pay Equity Fund had increased employment in the early childhood sector by 219 educators, or about 7%. Next slide, please. So here's the same figure, but now we're looking at the number of facilities, or so the number of employers or establishments, using the Department of Labor's terminology. And we can sort of see maybe a slight decrease here, but it corresponds to just about 3 or 4% fewer programs. So I'll contextualize this on the other effect on the next slide, please. Okay, so what do these differences really mean? Again, without getting into too many technical specifics, it is important to ask this question, right? Because these changes may have just happened anyways and could be due to chance, right? Or we could be confident in them, right? And call them quote unquote statistically significant, right? And attributable to the program. So what we did to determine this is essentially just we repeated the same process that I just described, but with all the other counties across the country, at least those that we included in our analysis. And of course, these other counties didn't have such a program. And so the quote unquote impacts that we see, right, would give us a sense of the range of effects that would just be expected due to chance. So if DC's impact is, relatively large, in the distribution of these other impacts, then it gives us some sense of how certain we are that it's due to the program. Okay, so with that in mind, next slide, please. I'll zoom through this, but here we're presenting the actual impact rather than the levels in the outcome over time, and we can see here that DC's impact, so as shown by this green line, right, it's over time becomes one of the very largest in the nation, and it emerges right after the start of the Pay Equity Fund, and in fact continues to grow in magnitude over time. Next slide. Okay, so this is just another way of kind of showing the same thing. This is the ranking of the DC's impact on the number of educators. It's larger than that, 96% of all the other counties, which allows us to say, okay, that it's statistically significant. So the impacts on the number of educators were statistically significant. I will leave it at that. Next slide, please. Right, and so here are the same findings for the number of facilities, and here we can see. Although DC's, it's actually a negative effect, if you recall, it was a smaller effect, however, and it's sort of within this range of other impacts on this outcome, and so it was not statistically significant. Oh, there must be an animation issue. I'm sorry. Thank you so much. So, oh no, you can go on to the next slide. Thanks, Kim. Okay, so to summarize, we first found that the Pay Equity Fund had a positive impact on early childhood labor supply through its first 2 years. As is relevant for evaluation of the program, which I'll discuss next, this positive impact relates back to families, right? So we estimated that a 7% increase in the number of educators, which we found, means an increase in nearly 1,500 additional childcare slots. We again didn't find that the program changed the number of facilities, however, which is important because it suggests that the program supported staffing within existing facilities. And at that, amidst it was a well-documented staffing shortage in this sector. Okay, so next slide, please. As I described at the beginning of the presentation, there are multiple ways to determine the effectiveness of a program, and another one is to focus on cost effectiveness. So increasing the wages of educators and subsidizing their health insurance, it's a substantial public investment. And we use what's called a benefit cost analysis to see whether this investment paid off. If the benefits of a program exceed the cost to implement it, then investing in it makes financial sense from a social perspective and a taxpayer perspective. So it's important to note here, right, that economic analysis is not everything. Treating educators equitably is important, but economic analysis is valuable, particularly when resources are limited, such as they are in the public sector. So we determine the return on investment, or ROI, of the program, again, focusing on the version of the program in 2023, where we have direct payments to educators and the fund beginning to subsidize health insurance. The methods here are not actually particularly complicated, but there's a ton of information that kind of goes into these calculations that I won't really go into here. But the basic approach is that we first calculate the costs, and then we estimate the financial value of the benefits, both using kind of existing evidence specifically on the program, such as that I just shared, and other existing evidence that we can kind of use to make some assumptions about the value of benefits in these other areas. And then finally, we compare the predicted value of benefits to the costs, which gives us an estimate of the ROI. Next slide, please. So we calculated that the total social cost of the fund was about $54 million for the year. This includes about $44 million for the direct payments, which were made to over 4,000 educators, as well as about $10 million for the health insurance piece of this, which served about 1,000 educators and some dependents in this, particular period of focus. Next slide, please. All right, so next we estimated the value of the many anticipated benefits of the program that I covered in the beginning. In total, we valued these benefits at $66.8 million. About 12% of these benefits were those that accrued to educators. All right, so these are things, right, in terms of reduced absenteeism and job turnover, productivity gains, improved health, and increased economic security. For facilities, there are efficiency gains, again, from lower recruitment and onboarding costs here, which amount to about 19% of all program benefits. We found that the main beneficiaries here are families, with benefits to this group accounting for nearly 70% of the total economic returns. Again, benefits to families include increased access to services, which we quantified using some of the findings I just shared on staffing, as well as improved quality of services. Okay, thank you so much. So taken together, when compared to the total cost of the program, this all reflects a net benefit of about $12.5 million, or a return on investment of 23%. So in other words, for every dollar invested in the pay equity fund, we estimated a one-year return to society of $1.23, and a 23% ROI, for context, would be considered a substantial return on investment. I think we can probably skip here just for time. There are several details in our report, including a breakdown of ROI by program component and so forth. Okay, so just to summarize again, these findings suggest a positive ROI of the program, which represent gains for diverse stakeholder groups. Our findings are also, I should say, likely to be conservative for a couple of reasons. We make conservative assumptions out of sort of an abundance of caution, and we only consider returns for 1 year, right, of the program. And then finally, we neither consider meaningful equity implications beyond the program's economic value, nor future economic returns, which may change, of course, along with the design of the program, as BB described. Even so, we conclude that the program more than sort of pays for itself and can be considered a strong public investment according to these findings. So I'll just quickly conclude. Next slide, please. All right, so again, we found positive impacts on staffing, which suggests that meaningful improvements are possible in a large and diverse setting like DC. As a researcher, it's been exciting to see these findings cited in justification of the budget for the Pay Equity Fund in fiscal year 25. There's also been some attention paid by other states and localities to DC's initiative, of course, I think as reflected by our the attendee list here. and some federal interest as well, including in support of a sort of a grant program that was proposed. Finally, I'll just maybe make a note that our ROI suggested that the program generates significant benefits that exceed costs, perhaps only because, right, this was such an ambitious investment, and maybe such an investment of that size might be necessary to achieve benefits that make these types of programs cost effective. Okay, so that's the end of my presentation. Thanks, everyone.
Owen, thank you very much. And again, really thank you for lifting up the value of doing an economic analysis when we are investing the kind of public dollars that are being invested. And it really speaks to a much broader audience. In early childhood, we know what the return on investment is and what we do in the classroom on a daily basis and what our teachers do and what our educators do. But it is really, really important to be able to make the case for the broader population that may be certainly contributing through their taxes, but may not necessarily be taking advantage because they may not have the very, very young children or grandchildren, et cetera. And so highlighting those benefits, I think, is really key, and applauding everyone here who's been involved in making sure that this kind of data is available right at the onset almost. It's the first phase, and there's already a study, and it already provides a very positive note to what the District of Columbia gets for having a pay equity fund, and it's not just the salaries to teachers. It is the broader society, and it's the broader social return, which I think is absolutely key. So thank you for doing that, and thank you for partnering. The other piece that Owen raised, and I'm sure Rukaya will raise, at the very beginning, he thanked a number of organizations. And that is a key piece of building coalition and building a broader coalition beyond that of facilities, providers, educators, but rather who else has an interest or should have an interest in early care and education in any city or state, and how do you bring them into the fold and bring their expertise to help support. And so thank you for raising that, Owen, in your presentation. So Rukaya, can you discuss the status of the program as it is now? We heard from Kim, and then we heard from Abby that rocky beginnings around some of the financial decisions that the city, the mayor had made. But discuss for us the status of the program, communications to providers, how that's done, and the implementation plans for the next year. Any threats to the program on its sustainability, and anything else we've missed, since you are really the on-the-ground person here. So thank you much.
Thanks, BB. And I come with kind of bearing two hats, in that I'm part of the Under 3 DC Coalition, which Kim described early on in our work, and I lead a lot of the policy work for that coalition. And I am also a member of the task force that Abby chaired. So I'm coming to this with the perspective of a policy nerd, an advocate, and one of the folks who was really thinking about how to implement this program and design it. And you can go to the next slide, Kim. And I wanted to start here. This is a picture of some of our early childhood educators and families in the district who, as they turned out to a rally when the Early Childhood Educator Pay Equity Fund was cut in the mayor's proposed budget. And I just love this image for a few reasons. First, it's a reminder of who are we working with and for to make this happen. And it's the educators who are in the classroom with our children every day. I certainly am extremely grateful to my toddler's educator and the things she manages to get him to do that I can't. And just the incredible amount of work that it takes to understand and support a young child's development. And I love that Miss Jackie in this photo, in the center of the photo, is holding up her diploma, reminding folks, hey, I'm here with this all of this work that I've done to learn how to do my job really well and increase my skills, and that will not be minimized. So I just wanted to start here. These educators are members of our coalition, and we come together to advocate for the program. And I'll talk a little bit about how we do that, but just want to kind of give a little bit of context about where we are today, now that the funds have been somewhat restored, mostly restored by the council. The task force had released its recommendations, which Abby talked about, and now our state agency is in the process of implementing those recommendations, which have now been put into temporary emergency law. So there's a few steps there that need to be worked out to make some of those recommendations permanent in law. But in the meantime, the task force and advocates and community members are working really closely, trying to inform our state agency about the best ways to communicate. And we know our state agency is working really hard to develop stronger and better communications with child development operators, so the child care center directors and operators, so that they really understand some of the changes that are coming in the next few months. And that they're able to make sure that with those changes coming down the pike, that they're able to continue to participate in the program, that their educators are able to continue to benefit, and that the program continues to be strengthened for the benefit of these educators on the screen and the children that they serve. So those are so that's a lot of the work that's happening in the task force, and in our coalition and our directors committee, our teachers committee, all of these places where educators and providers are really thinking about what is working for me and what's not in implementation. It is a tricky time because what we're doing is both deepening some of our equity commitments, but also because of some of the changes that Abby described, also some educators are losing potentially losing some of their pay increase through the pay equity fund. And so we really need to make sure that we're communicating clearly about why that's happening, opportunities to reclaim that increase, and make sure that everyone who wants to participate is able to do so. So that's where we are today. But I just wanted to maybe if we can go to the next slide, talk a little bit about what it took to get to this point, by just sharing the kind of breadth of advocacy strategies we've employed, because the program is never going to be a sure thing. We have done I think a very good job in making it the surest thing we can. We have a revenue stream that's a progressive revenue stream based on our revenue principles that we've established as a coalition. There is in law setting dollars aside for the program. It's a non-lapsing fund that should carry funds over from year to year if there is any leftover money. And it shouldn't be able to be used for any other purposes. But as secure as we, as advocates and as policymakers, and as the task force worked to make sure that this program was secure, it is only ever as secure as leadership in our government in DC and federal government. And so that's something that we will always continue to have to advocate for, to ensure that it remains a priority in our budget. So we've done a wide variety of things, both to get the law funded, to get it passed, and then to get the funds reinstated when they were cut, from op-eds to revenue town halls that we held ourselves because policymakers did not. We held town halls with council members so that they could get to know the early childhood educators and families in their communities. In the middle of the pandemic, we did a child caravan where we drove around to council members' houses and encouraged them to vote in support of revenue, and have conducted a wide variety of research and publications trying to make the case and make it easier for policymakers to support retaining this program and increasing funding for it as the years go on. So there's been a lot going into that, and we continue to do those things. And imagine that we will continue doing them for many years to come, to protect the fund. But some that I wanted to raise up were, for example, around the task force and its representation. The task force initially had a more limited range of experts that were going to be included, and our coalition looked at the list and said, hey, we need child development homes. We need family childcare represented here. We need early educators represented here. And so, so even throughout this process, even not the big parts, not the big exciting parts about, now we have a fund and now we have the dollars, even in the small parts of making this this happen, we've had to conduct really intentional advocacy to ensure that the pieces were constructed really thoughtfully, really equitably, and that the folks who needed to be at the table were at the table. And we will continue to do that. Next slide. I can't remember what's on the next slide. And the impacts have been great. It's been, and you heard from Owen about the dollars and cents, but we also know that more than 3,500 educators have benefited from higher salaries, that more than 1,700 educators and childcare staff, so not just educators, are participating in healthcare for childcare and getting free or reduced cost health insurance. And that 59% of the childcare programs who are now participating in the healthcare for childcare program did not offer health insurance before for their employees. So these are lots of new programs who were not able to do this prior to the district providing financial support for them to do so. We also know that 99% of subsidy providers in the district participate in the Pay Equity Fund. That means that kids, children, infants and toddlers who are in families with low and moderate income are benefiting from this program, and they have access to educators who are fairly paid, who are able to take care of their own health and their family's health, and are able to show up in the classroom at their best selves for young children. And lastly, we know that the increase to salaries has been, I know that in the first stage of the program, it was 40% increase, and we know that it stays above 30% for all educators. But there are some pieces that have not come through yet, and these are pieces that we will continue to need to push for. I don't have a slide for them, but I'll just say, one of the intents of the Birth to Three law was that early childhood educators would have pay on par with DC public school teachers with the same role, credential, and experience. And in the first stages of the program, we saw that it was going to be really complex to incorporate a salary schedule based on experience. And we still need to do that. And as we've had these budget fights over the last years, we've had to turn our attention to that. But we know that for us to have true parity with teachers of older children, we need to be able to increase educators' salaries with their experience and with inflation as time goes on. So that's one big one. And then we also have seen some unintended consequences to the program, unintended impacts within the program that I wouldn't say are bad, but there are things that we need to contend with the cost pressures of different roles in a facility who are not funded by the program, and how programs can balance having some folks who have received the significant pay increase and others who have not, because they are not one of the qualifying roles as educators. So really needing to just contend with that and decide how our policies can address those challenges and strengthen the system as much as possible. And we'll continue, I think, to be there will always be potential threats to the program as administrations change, but it's really critical to have really strong people power to remind policymakers of the need for these programs and to ensure that they continue their funding. And that's what that's what our role is. Happy to answer questions.
Thank you very much, Rakaya. And just, a couple of things that Rakaya lifted that obviously are really key. One is I don't think we can emphasize the importance of advocacy and the importance of broad-based advocacy. One of the things that is very evident is that the advocacy that has been developed through DC Action and the Birth to Three Coalition has really been to broaden it as much as possible so that you are building a really big tent of folks who support babies, their educators, and the stability and sustainability of the sector. as it exists, because we're working within the context of how early childhood exists, and that's a whole other different conversation, but I think really important. And when you think about 3,500 educators having benefited, the multiplier effect of that in a household with children, with the financial stability, the financial well-being of that particular family, and then the impact on the children in the classroom and the parents, as we heard from Owen. And so advocacy really is at the center of making sure that once you have a piece of legislation or policy done, that you have well-informed advocates and advocates who really understand the issues to be able to support as you move forward, because policymakers are constantly inundated by all kinds of interests. And so how do you make sure that the advocacy for this interest is upfront? So the work that the task force does is the technical pieces around this. The work that the coalition does is really about the voices, and certainly the work that we have from folks like Mathematica, it's to make sure that we can make the case in ways that some others understand it. And so please, let's thank our panelists for their wonderful presentations, and hopefully you have been able to receive a little bit of understanding about what this work has done. Please put questions in the chat or in the Q&A, and we'll be able to answer a few of those.
Travis,
Yes,
we'll turn it over. Oh, there you are. Hi.
absolutely. We have some great questions. I wanted to start, Rakaya, with you. There was a question from Jessica who just wanted some more clarity on, okay, I hear that some early educators, after you saved the pay equity fund and after the task force made some changes, largely preserving the salaries of most early educators. Why are some early educators losing their pay increases um, after the recent changes were made? Can you please just clarify that?
I think Abby can answer that question much better than I can, although so I'll turn it over to her.
Happy to, okay. So it is a good question, and it is a little bit confusing. But essentially what happened was that as the task force was looking at how we were going to fit this program into the financial parameters that we'd been handed, we knew that the only way to get all the way there was going to be to have some change in the minimum salaries. We did all the other tweaking we possibly could, and we realized that we're still short. So in looking at where we were going to do that, essentially what the task force decided was that any educators who had not yet earned a CDA, which is the minimum requirement for licensing for educators in the district, even if they were still teaching legally, because they get a certain amount of time before they have to get it. So, they get sort of a grace period. So they were in that grace period, but they had not earned the CDA. So the determination was that we'd essentially eliminate what had been a minimum salary of around 43,000 and change, which is a little over $21 an hour for those folks. And we would just put them back at the minimum salary of DC's minimum wage and living wage, which is $17.50 an hour. And once they earn their CDA, then they're eligible for that increase in minimum salary. But in the meantime, they would not have that guarantee. And so while childcare providers could still keep them at that salary that they had been, it's really hard to do that. It's hard for them to make those ends meet without that additional funding they would get from the pay equity fund. So we hope that over time, this will encourage folks to more quickly get their CDAs. And I saw someone else asked a question about whether DC offers ways for people to earn their CDAs. The answer to that question is a resounding yes. So the state agency has free programs available to childcare educators at various different times in different languages to be able to get their CDA in a relatively short period of time. So there's definitely access to those programs. Still takes some time, and obviously time is is a challenge for folks. But to the extent you could possibly make it as easy as possible, I think the district has done a very good job of that.
That's amazing, Abby. Thank you so much. And actually, to keep it with you, there was another, folks were very interested in the equity piece regarding the formula for the Pay Equity Fund, how you treat smaller privately owned centers and the amount of funds they receive versus how you calculate funds for, say, centers backed by larger corporations. You did mention this in your presentation, but if you could just any more context you could provide, that'd be very helpful.
Yeah. So again, it's a good question. It's something that the task force very directly talked about. So as the person asking the question noted, and as folks on this call, I'm sure all know, there are a number of big national chains that are backed by private equity or that are publicly traded. And the concern was, how do we ensure that this public money that we're putting out is not going to line the pockets of investors, but instead is going to high quality childcare and going to the salaries that we set. So the first piece of it is that in order to participate in the Pay Equity Fund, you have to meet the minimum salaries. And so we want providers to participate because we want all of our educators to have that minimum salary. So we want to encourage participation, and we don't want but we want to encourage it just to the point where you can afford to do it as a provider, but not be adding to the profits of large national corporations. And so there are a couple of ways in which we did that. One is that practically speaking, so we don't have anything that says if you're a national chain, you don't get X or Y, but practically speaking, those providers tend to be at the very high end of the tuition range. And so they are not eligible for several elements now of the formula moving forward. So there's an administrative enhancement that's 12% of your base, to get technical, that they won't be eligible for. They're not eligible for an infant toddler enhancement either. And most of those programs serve few or no children who are receiving subsidy. And since we doubled down on the investment in those centers that do serve high numbers of subsidy, those dollars will go to those centers and not to the large centers that tend not to serve those children. So in all those ways, we think that the equity target will address that issue and still keep them engaged in the program so that their educators are getting those minimums.
Thank you, Abby. And again, this just shows how even in tough situations, when you are centering equity and figuring out how to move forward, you really can come up with some creative solutions. These are all the questions that I have seen. I'm going to turn it back to you, BB.
Thank you.
I see one other question on feedback from employers regarding improved employee attendance and or productivity. And I think the quick answer to that is we have some anecdotal, but we expect to have a lot more. That the Urban Institute is doing an implementation study, and they've just done another round of interviews and surveys with both frontline educators and then owners and providers. So hopefully we'll have that kind of data pretty soon.
There was another
Great.
question I saw in the
Mhm.
Q&A.
Yeah,
Did we catch all the
Um,
questions?
there's one other. Rakaya, go ahead and read the one you see.
Yeah, the question is, well, there are a couple of them.
I was looking at
Well,
the
it was in the
track.
chat. It was how many educators were impacted by the reduction or the removal of the minimum salary for folks who haven't met the credentialing requirements.
Yes.
And it's not a small number, but it's about 600 assistant teachers and 700 lead teachers who haven't met their credentialing requirements. And something just to kind of build on what Abby said is that these educators who haven't met those requirements are now employed under a certification that is if they're in need of an AA, I think it's a 2-year certification. If they're in need of if they're in need of a CDA, it's a 2-year certification. If they're in need of an AA, it's a 4-year. And it's basically certification that they are enrolled in a program, so that in progress to attaining that credential. So all of them are theoretically in progress, and we will see over the years how what the rate of completion looks like, to know how many of them actually complete the program. But in theory, everyone is in a program. They have to certify that they are, and they have a little bit of wiggle room to get that done in time to keep their certification.
And I'll jump in. And there are a couple of other. I think Abby mentioned that there's significant funding available for both. There's CDA offered across the city by various. In fact, many providers themselves offering the CDA, and there's also a Spanish language AA for infants and toddlers in our in the University of the District of Columbia, which is first certainly in the district, and that affords a lot of our, as we know, so many of our educators are Black and brown women, many immigrant women, and some men. But it is really important for us to for the district to make it as available as possible so that folks aren't penalized for not having their credentialing. And there are a number of options that are virtual also for folks to finish up their degrees or their certifications. So I think that if that's all the questions we have, I just want to thank the panel again for a wonderful presentation. I'm sure we will have others, as Abby talked about the Urban Institute study and coupled with Owen's study and continuing forward. I'm sure that we will be able to share more information in the next year or so. So I'll turn it over to Kim. Thank you, Kim.
Well, thank you, BB. And again, thanks so much to our panelists, Dr. Owen Shoshay, Abigail Smith, and Rakaya Ambar Shaheen. And BB, you are always the most eloquent moderator. Thank you so much for setting that context.